Right now, somewhere in the world, a person is having a stroke and has absolutely no idea. They think they are tired, they think they slept funny, they think maybe it was something they ate. And while they wait and wonder, their brain, the most complex and irreplaceable organ in the human body, is dying. Not slowly, not eventually. Right now, in real time, at the rate of approximately 1.9 million brain cells every single minute. Let me say that again, 1.9 million neurons gone every 60 seconds. That means by the time most people actually call for help, they may have already lost more brain tissue than a person experiences in 10 years of normal aging. And here is the part that haunts every neurologist, every emergency physician, every paramedic who has seen this story play out too many times. Most of those lost cells, most of that lost function, most of that lost life, it was preventable. The treatment exists, the window exists, the protocol exists, but only if you know what to do, and only if you act within that critical 3-hour window. That is exactly what we are going to break down today, step by step, in a way that could genuinely save your life or the life of someone you love. So let us start at the very beginning, because the first thing you need to understand is what a stroke actually is at the biological level. Because once you understand that, everything else, the urgency, the symptoms, the treatment, will make complete sense. Your brain is the hungriest organ in your body. It makes up only about 2% of your body weight, but it consumes roughly 20% of your body's oxygen and glucose supply. It is running constantly, at full capacity, with almost no reserves. The brain cannot store energy the way your muscles can. It depends on a continuous, uninterrupted flow of oxygen-rich blood through a dense network of arteries and vessels. Now, when something disrupts that blood flow, whether it is a clot blocking an artery or a blood vessel rupturing and bleeding into the brain tissue, brain cells begin to starve immediately. And unlike cells in other parts of your body, neurons are exceptionally unforgiving. They do not bounce back from oxygen deprivation the way muscle tissue might. When they are gone, in most cases, they are gone. There are two major types of stroke, and understanding the difference matters enormously because they have different causes, different treatments, and in some ways different warning signs. The first type, and by far the most common, accounting for roughly 87% of all strokes, is called an ischemic stroke. Ischemic simply means related to a lack of blood flow. In an ischemic stroke, a blood clot blocks an artery that supplies the brain. That clot might have formed right there in the brain's blood vessels, a process called a thrombotic stroke. Or the clot might have formed somewhere else in the body, often in the heart, particularly in people with a condition called atrial fibrillation, and then traveled through the bloodstream until it got lodged in a brain artery. That is called an embolic stroke. Either way, the result is the same. A section of the brain is suddenly cut off from blood and oxygen, and it begins to die. The second type, far less common but potentially more deadly, is a hemorrhagic stroke. This happens when a blood vessel in the brain ruptures and bleeds. That bleed creates pressure inside the skull, a space that has absolutely no room to accommodate extra fluid, and that pressure begins crushing brain tissue. Hemorrhagic strokes can be caused by high blood pressure, aneurysms, or arteriovenous malformations. And here is something critically important that we will come back to. The treatments for these two types of stroke are dramatically different. What saves a life in an ischemic stroke can actually worsen a hemorrhagic stroke. This is why you never ever try to treat a stroke at home. You call emergency services and let the hospital determine which type it is. Now let us talk about recognizing a stroke, because speed is everything here. And you cannot act fast if you do not know what you are looking at. The medical community has given us an acronym that has saved countless lives, and that acronym is B FAST. The B stands for balance. A sudden, unexplained loss of balance or coordination, someone stumbling, unable to walk a straight line, feeling like the room is spinning without obvious cause, can be an early sign of stroke, particularly when it involves the cerebellum or the brainstem. The E stands for eyes. Sudden vision changes are a major red flag. This could be blurred vision, double vision, or a sudden loss of vision in one or both eyes. Some people describe it as a curtain being drawn across part of their visual field. The F stands for face. Ask the person to smile. If one side of their face droops, if the smile is uneven, if they look lopsided, that is a warning sign. The A is for arms. Ask the person to raise both arms at the same time and hold them out. If one arm drifts downward involuntarily, if they cannot hold both arms up, if one side seems significantly weaker, that is a warning sign. The S stands for speech. This is one of the most recognizable stroke symptoms. Ask the person to repeat a simple sentence. Their speech may be slurred, garbled, or entirely absent. They might use completely wrong words. They might be unable to understand what you are saying to them. And the T, and this is arguably the most important letter of all, stands for time. Time to call emergency services immediately, not after you have called a family member, not after you have looked it up online, not after you have waited to see if it gets better, immediately. Here is what most people do not realize about stroke symptoms, and this misunderstanding is one of the leading reasons people arrive at the hospital too late. Stroke symptoms can fluctuate. They can appear, then seem to ease up, and people think the danger has passed. There is actually a specific phenomenon called a transient ischemic attack, or TIA, which people sometimes call a mini-stroke. In a TIA, blood flow is temporarily disrupted but restores itself before permanent damage occurs. The symptoms might last only minutes, and this is where people make a fatal mistake. They feel better, they think everything is fine, and they go back to bed. But a TIA is not a sign that the danger has passed. A TIA is a warning, a fire alarm. It is your body telling you that a major stroke may be imminent, potentially within hours or days. Studies consistently show that approximately 10 to 15% of people who have a TIA will suffer a full stroke within 3 months, and about half of those will occur within the first 48 hours. So if someone experiences these symptoms, even briefly, even if they resolved, they need to go to the emergency room immediately, full stop. Now let us get to the 3-hour window, because this is the core of what you came here to learn. When an ischemic stroke occurs, there are essentially 2 zones of damage happening simultaneously in the brain. There is the core, the area directly supplied by the blocked artery, where brain cells begin dying within minutes. And then there is the penumbra, a ring of tissue surrounding that core that is still alive, still fighting, receiving some blood flow from neighboring vessels, but deeply vulnerable. The penumbra is salvageable. Those cells can be saved if blood flow is restored in time. And the primary way we restore blood flow in an ischemic stroke is with a drug called TPA, tissue plasminogen activator. TPA is a clot-busting medication. It works by dissolving the blood clot that is blocking the artery, restoring blood flow, and allowing that penumbral tissue to survive. It is quite literally a brain-saving drug. But here is the catch, and here is why that clock is so critical. TPA is only approved and considered safe for use within a specific time window from the onset of symptoms. Traditionally, that window was 3 hours. Current guidelines from many stroke specialists and major medical organizations have extended that window to up to 4.5 hours in carefully selected patients. But the data is extraordinarily clear. The sooner treatment begins, the better the outcomes. Every minute of delay means more brain tissue lost and a narrower chance of full recovery. The phrase doctors use in stroke medicine is this: time is brain. It is not a slogan. It is a biological fact. So here is exactly what you need to do if you suspect someone is having a stroke. Step 1. Call emergency services immediately. In most countries, that is 911, 999, or your local emergency number. Do not drive the person to the hospital yourself unless you have absolutely no other option. Ambulances are equipped with communication systems that allow the hospital to begin preparing while the patient is still en route. That head start can mean the difference between full recovery and permanent disability. Step 2. Note the time you first noticed the symptoms. This is critical information the medical team will need. Write it down. Take a photo of a clock if you have to. When the doctors ask, "When did symptoms start?" that answer determines whether TPA can be given at all. Step 3. Keep the person calm and still. Help them sit or lie down in a safe position, ideally lying on their side if they are unconscious or vomiting to prevent choking. Step 4. Do not give them anything to eat or drink. Stroke patients have a high risk of aspiration, accidentally inhaling food or liquid into their lungs, because the swallowing reflex may be impaired. Step 5. Do not give aspirin. This one surprises people. Many folks know that aspirin is used in heart attacks, and they assume the same logic applies to stroke. But here is the danger. You cannot know at home whether the stroke is ischemic or hemorrhagic. If it is hemorrhagic, giving aspirin, which thins the blood, could dramatically worsen the bleed and accelerate brain damage. Leave medication decisions entirely to the medical team. Let us talk about what happens when the ambulance arrives and the patient gets to the hospital, because understanding the in-hospital protocol reinforces just how time-sensitive every step is. Modern stroke care is organized around what is called a stroke protocol or code stroke. When a stroke patient arrives at a stroke-capable hospital, the goal is to go from the moment they walk through the door to the moment TPA is administered in 60 minutes or less. That benchmark is called door-to-needle time, and it is one of the most closely tracked metrics in emergency medicine. The patient will immediately receive a CT scan of the brain. This takes only a few minutes and can differentiate between ischemic and hemorrhagic stroke. Blood work is drawn simultaneously. A neurologist is either present or available by telemedicine. If the patient meets the criteria for TPA, ischemic stroke, within the time window, no contraindications, the drug begins flowing. Beyond TPA, for certain large vessel occlusions, meaning a clot in one of the major brain arteries, there is a procedure called mechanical thrombectomy, where specially trained physicians thread a catheter through the blood vessels and physically remove the clot. This technique has revolutionized stroke outcomes and can sometimes be performed beyond the TPA window, up to 24 hours in carefully selected patients. But again, every minute matters. Now let us talk about who is most at risk for stroke, because prevention is the most powerful tool we have. The major controllable risk factors for stroke include high blood pressure, which is the single most significant modifiable risk factor for stroke worldwide. Uncontrolled hypertension damages blood vessel walls, promotes clot formation, and directly increases the risk of both ischemic and hemorrhagic stroke. Managing your blood pressure through diet, exercise, and medication if necessary is one of the most impactful things you can do for your brain health. Atrial fibrillation, a type of irregular heart rhythm, dramatically raises stroke risk by promoting clot formation in the heart. Diabetes damages blood vessels throughout the body, including those supplying the brain. High cholesterol leads to atherosclerosis, the buildup of plaques inside artery walls, which can narrow blood vessels and form clots. Smoking doubles the risk of stroke. Obesity, physical inactivity, heavy alcohol use, and sleep apnea are all significant contributing factors. The uncontrollable risk factors include age. Stroke risk approximately doubles every decade after age 55, family history, sex and prior stroke or TIA history. But the empowering truth is that up to 80% of strokes are estimated to be preventable through lifestyle modification and proper management of medical conditions. There is one more thing that must be addressed, and that is what happens after a stroke in the recovery phase, because the same principle that governs emergency treatment governs recovery. The faster and more aggressively rehabilitation begins, the better the outcomes. The brain has a remarkable, though limited, ability to reorganize itself after injury, a property called neuroplasticity. Surrounding areas of the brain can sometimes take over functions that were lost when stroke-affected regions were damaged. Physical therapy, occupational therapy, speech therapy, and cognitive rehabilitation all capitalize on this plasticity. But neuroplasticity is not indefinite. The the greatest window for recovery is in the first 3 to 6 months post-stroke, and the intensity and consistency of rehabilitation during that period directly correlates with how much function a person can regain. So the lesson does not end with surviving the stroke. It continues into recovery with the same urgency and commitment. Let us bring this all together, because what you have learned today is not just medical information, it is a potential life-saving protocol. If you take one thing away from this video, let it be this: the difference between dying, surviving with severe disability, and making a near-complete recovery from a stroke often comes down to the decisions made in the first 3 hours. Recognize the signs using Be Fast: balance, eyes, face, arms, speech, time. Call emergency services immediately. Note the time symptoms began. Do not give food, water, or aspirin. And understand that every single minute of delay has a measurable, permanent cost. You now have knowledge that most people never acquire until it is too late. That knowledge is the protocol. If you found this information valuable, and honestly, this is the kind of content that belongs on every person's phone, shared with every family member, please take 5 seconds right now and subscribe to this channel so you never miss a video that could protect your health or the health of someone you love. Hit the like button if this opened your eyes to something you did not know before, because it helps more people find this content when they need it most. And drop a comment below and let me know. Did you already know the Be Fast acronym, or was this new information for you? I read every comment. And tell me what health topic you want me to cover next. I will see you in the next one.